Let's talk about recurrent aphthous ulcers. Those pesky, painful mouth sores that just love to come back. You probably know them as canker sores, but in medical terms, we're talking about RAUs. These are among the most common oral mucosal conditions, especially in young adults. Now, here's the thing. They're idiopathic in most cases. We don't always know why they happen, but we do have some pretty solid associations. For instance, many patients report a family history, suggesting a genetic predisposition. Then you've got potential triggers like stress, trauma, to the oral mucosa, say from biting the cheek or aggressive brushing. Nutritional deficiencies, particularly iron, folate, and vitamin B12, and even food sensitivities like to gluten or certain preservatives. There are three main clinical types: minor, major, and herpetiform. Minor RAUs are the most common. They're usually small, less than a centimeter, round or oval, with a yellow or gray base and a red halo. Painful, but they heal spontaneously in 7 to 10 days without scarring. Major aphthy, on the other hand, are larger and deeper, can persist for weeks, and often heal with scarring. Herpetiform ulcers? Don't let the name fool you. They're not related to herpes viruses. These are clusters of tiny ulcers that can merge into larger, irregular lesions. They're less common, but very painful and recurrent. So how do we diagnose RAUs? Primarily, it's clinical. There's no specific test, but you rule out other causes, especially systemic diseases like Behçet's disease, inflammatory bowel disease, and celiac disease, if the ulcers are severe, frequent, or accompanied by systemic symptoms. Blood tests can help check for those nutritional deficiencies or systemic markers. Treatment is mostly symptomatic. Topical corticosteroids like triamcinolone acetonide or clobetasol in an Orabase are first line. They reduce inflammation and pain. If lesions are particularly painful, topical anesthetics like lidocaine can help. In severe or refractory cases, systemic therapy may be needed. Short courses of systemic steroids, immunomodulators like colchicine, or even biologics in very rare, complex cases. And let's not forget patient education. Reassurance is important. These ulcers are benign, though frustrating. We encourage patients to keep a symptom diary to identify and avoid potential triggers. Sometimes dietary adjustments or stress reduction strategies can make a big difference. So, in summary, RAUs are common, painful, and idiopathic in most cases. While minor aphthy resolve on their own, more severe types need tailored management. Always keep an eye out for red flags pointing to systemic disease, and be proactive about managing underlying deficiencies or triggers. All right, that's a wrap on recurrent aphthous ulcers. Let's keep this knowledge sharp for the clinic and the boards.